Hello, my name's Chloe Briner, and for my honors project this semester, I explored anatomical differences between males and females and how these differences may increase the risk of developing injuries or diseases. And so basically what sparked my interest for this topic was in junior year of high school, I tore my ACL and I went to the physical therapist, and she actually explained to me that women are more likely than males to experience ACL injuries due to their wider pelvis, and I was like, I wish I could explore that further, and this project was an opportunity for me to further explore that and see if there were other things that could cause an increased risk also. And so for this project, I explored several online journals and articles to learn more about differences between males and females, anatomical differences, and how they also could lead to developing different injuries or diseases. And I gathered so much information that differences in males and females that could have this, such as bone density, brain size, lung capacity, and all these things really increase the risk of diseases or injuries in males or females. So the first thing that I did was brain size and distributions, and I found that males have larger overall brain dimensions than females, and females have increased regional gray matter, and they also have a larger hippocampus in their brain. And I found that there was a study from JAMA Psychiatry, and it indicated that females with autism spectrum disorder actually had a cortical thickness similar to males without autism spectrum disorder. And it suggested that individuals who have a cortical thickness similar to that of a typical biological male are more likely to have autism spectrum disorder. I also studied size and shape of pelvis, and I found that females have larger and broader, wider pelvises, while males have taller and more narrow pelvises. And because of the wider pelvis, females experience more stress on the soft tissues around their joints, and this is because the locomotion is different between the femur, patella, and tibia. So while females sort of are inward, they sort of go inward because of their pelvis and then their knee joints, males are more upright and narrow, and so it is all one motion sort of, whereas females are like that. And this increased the risk of tearing ligaments in their lower extremities for females, specifically their ACL, because of the increased stress that they experience. I also studied characteristics of ligaments and tendons, and I found that females have smaller ligaments than males, and tendons in males are stiffer, and specifically the Achilles tendon are larger in males than in females. And that caused for males to have 5 to 1 times more likely than females to experience Achilles tendon ruptures due to the difference in their stiffness and size. And then females also have looser ligaments than males do, which makes them more susceptible to ligament tears as well, like the ACL tear. I also studied white and red blood cell production, and males have more testosterone than females, which causes a greater hematocrit. And then females lose more blood than males due to menstruation monthly. And then males also have more leukocytes than females. And so this causes for women to have more likely to become anemic than males due to the lower hematocrit naturally. And then males also have more leukocytes, which help fight off infections. So females are more likely to get infections, and it should take a longer time for them to fight off said infections than males would. And then females also have to go through a menstrual cycle, and this causes blood loss in general, which more blood loss than which is necessary, which can happen sometimes, is called menophagia, and that is more likely to prevail in females because of menstruation. And then the presence of more testosterone versus estrogen. Females have more estrogen in their body, and males have more testosterone, and this triggers a process for making blood cells, and it's triggered by testosterone. So males make more blood cells than females do. And this causes males to have a higher risk of heart disease because of their increase in testosterone. And then also a study conducted found that more testosterone actually leads to a decrease in HDLs, or your good cholesterol present in an individual, and that less estrogen in the body creates an increased blood sugar level. So it also causes males to have more testosterone, which would mean a greater hematocrit, which makes females have a higher chance of becoming anemic because they have less red blood cells than males do. I also studied body fat percentage. Females typically have a higher body fat percentage than males, and females carry more fat in their abdominal and gluteal femoral regions. Because so a high body fat percentage leads to obesity in both genders, but because females already have a higher body fat percentage, it leads to an increased risk of obesity in females than in males. And then with obesity comes other risk factors such as high blood pressure, type 2 diabetes, heart disease, and stroke. And then I also studied the lung size and capacity. So males have larger lungs as well as greater lung capacity than females. So females generally have much smaller airways and respiratory muscles. And this leads for females to be more likely than males to develop asthma and have shortness of breath more often while exercising. And then also female smokers opposed to male smokers are more susceptible to get COPD because they both intake the same amount of tobacco, but because women have smaller lungs and smaller airways, it actually seems more. And then I also studied muscle mass and bone mass. And so males have more skeletal muscle than females, and males have a greater bone density than females do. Also, males have a larger frame, which makes it so they have more stress and strain receptors than females, and they experience more stress and strain. So risks that come along with this are females tend to have less bone density, so they're more likely to experience osteoporosis as they age and as the bone density decreases even more. And then also because females experience less stress and strain, they experience more bone resorption, which also leads to osteoporosis and bones breaking down. And then here are my sources. Okay, thank you.